I'm excited to bring in our next guest. We've talked with you once before, but I think in 2021, the focus on the COVID-19 crisis is really turning to the vaccine. With us now on the show is Mark Navin. He's a professor and chair of philosophy at the Oakland University, but you're also a lecturer in foundational medicine and medical studies at the Oakland University, William Beaumont. Always great to have you with us. Thank you for being with us.
Thanks, Ronnie. Glad to be back.
So tell us if we can just start off. I did tweet out and share the information about tonight's event. So fill in everyone about the event and the panel and why and how this came about.
Well, so we at Oakland University are really delighted tonight to host some medical and public health experts to help answer people's questions about COVID vaccine and how effective and safe it is, and also when people can expect to get it, and some of these more complicated sort of political questions that you were talking about in the earlier segment that are affecting us all. So we've got Dr. Bagdasarian, the senior public health physician with Michigan Department of Health and Human Services, Dr. Faust, who's the health officer for Oakland County, Dr. Gilpin, who's been sort of running a COVID vaccine for the Beaumont system. And we've got Reverend McDonald, who's the lead pastor at Prospect Missionary Baptist Church in Pontiac, who's going to help us think about some of the community issues that we're working on in promoting acceptance of COVID vaccine and really coming to terms with the way that COVID disease and our attempts to manage that disease have ravaged our communities and our sort of hopes for entering the vaccine era, which we're taking our steps into in a really exciting way.
Professor, I love that you're putting on this event because this is not just a one street conversation. There are so many different factors that go into this. And even just talking about the different cultural issues and how the public or how the government is going about trying to share this message of why people should get vaccinated in different communities, because people receive the information differently, but also we have various issues from the past that come into these, some being religious, but also, the government has not always been trusted from members of the Black community, and we can understand that.
Well, so vaccination, as you say, is not just a matter of facts and figures of science, but it's a matter of social and political and historical facts about how we go about making decisions and living together. And you're entirely right. It needs to be a two-way conversation, and the community voice needs to be central in promoting vaccine acceptance, because ultimately vaccines aren't something that sort of are done to people, but that the community decides to do to itself for its own reasons.
Why do you think we're getting so much of a pushback on this vaccine? Because vaccinations are not new in our country. They've been around for years. In fact, I just saw a commercial for, the HPV vaccine, which was fairly new a few years ago when it came out. So why are we starting to see some of this pushback, do you think?
Yeah, I mean, maybe I'd want to reframe the question a little bit. I don't think we're seeing a lot of pushback. I think we're seeing some hesitancy, and that's normal. But so what we really are seeing is amazing demand. So some of the healthcare systems that I've consulted with and other organizations, they're overwhelmed with demand for this vaccine. People want it and they can't get it. And that's really the issue right now. It's true that some of the healthcare providers who were offered in those sort of first weeks of phase 1A decided to defer the vaccine. But almost all of nurses and physicians got it. A lot of people who defer, this is one story people haven't told, that it's often been reported 30 to 40% of healthcare professionals deferred the vaccine. Those numbers were highest among the environmental services workers, like your janitors and the food service workers. The nurses and the doctors, almost all of them went and got it. And that difference by service line breaks down in some of the sort of race and socioeconomic status and sort of trust differences that you appealed to before. But I would say the real story is demand and scarcity and hesitancy, which isn't necessarily refusal, but a real natural wait and see approach, which is usually, in many cases, the right thing to do. When something is very new and no one you know has done it before, very few of us want to be the first person to do things. And I sometimes think when I talk to friends in the media or in the academy that, look, we are people who choose to go into media or into the academy or into medicine are often people who are doing things that no one else in their family has done before. Right? They're often like risk takers in that way. And I think most people aren't like that. And it's entirely reasonable for people to want to feel that at people, they look around and see that people like them are doing something before they do it. And so I don't think that's pushback. I think it's taking some time. And I keep hearing these stories that, hey, because I was worried a little bit in December, maybe in January, but now I'm seeing all these elderly people waiting in line or staying on hold for 2 hours or driving around to try and get to these clinics. Maybe this is the right choice for me now that I'm seeing so many other people trying to get this vaccine.
I am going to say I'm happy to be at the back of the bus on this one, because by the time it comes available to the general public, we'll really kind of start to understand and see some of these issues. But on top of that too, we've had an ICU nurse on that she had the vaccine, and she said, if people have seen what I have seen over the past 10 months, they would not hesitate to get this vaccine. But the vaccine also, for it to work for our community, to bring us out of the back end of the pandemic, we need buy-in. We need people to get this.
Well, and I think the way you get buy-in is often slowly. So I'm someone who I have a lot of trust in institutional science and in physicians. And, one reason for that is I'm especially privileged and don't come from a tradition and culture of distrust and abuse and oppression. But I think it's entirely reasonable to think that buy-in takes time, and it's something you have to proactively cultivate. So I think people in public health know this very, very well. I think that sometimes those of us who get sort of angry about the so-called anti-vaccine people want to say, well, why don't you agree? Why are you resisting? Why aren't you buying in? Well, actually, it's public health's job to sell vaccine to people, and they're doing a great job, right? America gave 1.4 million doses last year. Every day, yesterday or so, every day we're giving more doses. The trend lines are all good. There are these real concerns, but I see them largely evaporating for people as time goes by. And so obviously there's work to be done, but I would frame it's work that public health is doing and that has a responsibility to do, rather than that there are people who have any sort of blameworthy hesitancy or refusal at this point.
So, Professor, I'd like your perspective on this next question, in that a lot of people, I think, that maybe wouldn't have gotten the vaccine before, but now, in order to really go through society, they work in industries that they're being required to get the vaccine if they want to be able to do certain things or visit certain customers if they're in the sales industry. And I think eventually it's going to get to the point that in order to go to like a football game in a stadium or something of that nature, we're going to have to show that we had the vaccine or we've had a recent COVID-19 negative test, which kind of poses its own questions because we know testing hasn't been 100% accurate. What are your thoughts on the requirement of the vaccine to be able to do things in our society?
So it's a good question. And so I think normally when we think about vaccine mandates, we're talking about children going to school. And so we're already on different turf here because we're talking about adults. And normally when we talk about vaccine mandates, we're talking about vaccines that have been around for decades, right? And given millions and millions of times. And this is a new vaccine. So we're on two sort of different grounds, talking about adults and a new vaccine. So I think that the closest analog is seasonal influenza vaccine mandates. And we have those. People who work in hospitals or congregate living situations often have that mandate. But we have it because tens of thousands of people die of seasonal influenza every year, and some people are at heightened risk of either getting it or transmitting it. And so I think it's entirely reasonable in the short term for us to think about some COVID vaccine mandates. I'm wary right now to be putting too much attention on that, because really the issue is scarcity. Really, the issue right now is not we've got a lot of people that don't want it and we're trying to force it on them. The real issue is we have a lot of people who want it and we can't get it to them. And I would much rather we spent our time focused on getting the vaccine to people who want it and prioritizing, thinking of reopening in those terms. So, for example, some school districts, some states have been thinking about reopening in terms of making sure teachers have already had access to the vaccines under phase 1B. And before even considering reopening. And so thinking of not as a mandate, but as a sort of access before you open up, rather than a mandate before you open up. But I think it's reasonable to think about mandates down the road, but I just don't think they are sort of primary issue.
I love like I even forgot about some places requiring the flu vaccine. I worked at plenty of places where they have pushed it on you, they were like, if you didn't get it, they were like sending you an email, hey, you missed your blah, blah, blah. And I was like, no, I know. Because I will say I don't get the flu vaccine. And that's just a personal choice. And I think that's one of the issues people have. But also when you were saying, when it comes to the scarcity right now, we were putting so much hope on this vaccine. But at the beginning, it's like I look at the rollout of this and you hear, because the politicians will get up there and they'll speak and they sound great for a 10-second soundbite. But the reality of actually getting people in, getting shots in the arm and rolling it out, it's totally different. And you wonder, like, too, like, about how many is going to be produced. We cannot expect everyone to get it at the same time. And I'm looking at the rollout. What are your thoughts and your perspective on how this vaccine is being rolled out to the public? Should we have waited? If we're going to mandate that schools go back in session by March 1st, should we have put teachers at the top of that list to get the vaccine?
So a lot of great questions there. Fortunately, I'm not a politician, so I get to say whatever I want about this. So I would say there's a sort of macro and a micro issue. From the macro point of view, the United States, vaccinating 1.4 million people per day and more every day is a success story. And if that line keeps going up, all to the good. And if you look at internationally, we're actually doing okay. There's some countries like Israel that are doing a lot better than us, but we're actually doing better than most countries. That's not to say that we're doing great, but comparatively, I think we're doing pretty well compared to most other countries. The rollout has been a mess for a variety of reasons, and that have been well discussed. So lack of clear communication from the federal government about when vaccine was coming or what vaccine there was, lack of coordination and direction to the states, and then states making decisions that perhaps you know something about in Michigan to defer some allocation prioritization decisions to local health departments and to the healthcare systems. So I've definitely heard people complain that, well, at Henry Ford, such and such group of people can get the vaccine, but at Beaumont, only the other people can get the vaccine. And at here, you have to call, and here you have to show up, and here you have to email. And I think these mixed messages and different allocation schemes of who goes first when can be at the very least confusing and can certainly seem unfair, even though, at least in my experience, all the local and state health department people I talk to and all the healthcare system people I've worked with are trying to do the best with what they've got, but it's a deeply broken system. So that's the general point. On the teachers, it is the case the teachers are very highly prioritized. So they are towards the top of phase 1B. So right, phase 1A was the one we basically wrapped up. That's the healthcare providers and the long-term care facility residents and workers. Phase 1B is now the 75 and older. In Michigan, there are two top groups in phase 1B, 75 and older, and the prioritized essential workers who are engaging in sort of sustained contact potentially with people who have disease. And teachers are in that. So teachers are in that phase 1B. So I would say that they've been quite prioritized from the point of allocation.
So what is your perspective or your thoughts on the change of the presidency and the new Biden administration? How is that going to change the conversation around vaccines, do you think?
I don't know. I mean, I'm waiting to see. Here's what it doesn't do. It doesn't overnight make millions of doses of vaccine appear, right? The doses are what they are. I'm hopeful that there's going to be increased communication and transparency, but politicians are politicians, so who knows about that? I'm hoping that there's going to be greater sort of guidance and coordination, but we shall see. I mean, the real issue is we need vaccines and to put them in arms, and we don't have enough. I don't think a change of administration immediately helps with that. I mean, maybe down the road, right, with the Defense Authorization Act, maybe depending on how FDA responds to the Johnson & Johnson application, maybe if we ever see the AstraZeneca vaccine come to FDA, maybe that's a difference. But I think we're in a wait and see approach right now with the change of the federal administration.
This kind of takes us back to where we were with testing in the beginning, right? Like you couldn't get a test because there is a process to go through. It's not a light switch that you can click on and everything's available that you need. I mean, 10 plus months into this pandemic, and I'm just now able to find Clorox wipes pretty steadily on the store shelves. I mean, Lysol spray is still kind of out there, but on top of that, you look at some of these other countries, this is not the first, it may be the first pandemic for the United States in the past 100 years, but other countries have also gone through some of these pandemics. I watched a recent documentary about the Ebola outbreak, and you look at that and you're like, oh my gosh, it like wakes you're really wondering like why we weren't more prepared for this, watching what other countries went through, but they did the same thing. They shut down schools, they shut down businesses, and you understand once we're now going through it and it's impacting us on a day-to-day basis what they went through. So what do you think is going to be the conversation with the public from your perspective, because you're a piece of the puzzle and there are so many pieces of this puzzle to be able to help bring this pandemic to an end?
Yeah, I mean, so here's big picture how I think about it. The purpose of having a government, I don't care if you're Republican or Democrat or Libertarian, the purpose of having government fundamentally is to keep us safe from predictable serious harms. And we generally as a society do a pretty good job of planning to keep us safe from war, right? America's got a great military, and we are on a sort of preventive footing, right? Prepared to with contingency plans and resources to fight all kinds of conflicts. We do a much worse job being well funded and prepared to protect our community from disease. But disease has actually killed more human beings than war in the history of humanity. And it's predictable. We know it's always coming. And there's a nice analogy with military as well. In the early history of America, we didn't have a standing army. Every time there was a war, we would mobilize for the war. And eventually we realized, hey, that takes an awful lot of time and inefficiency. We should have a professionalized warfighting class that is just always prepared and fully funded to go and do that work. And I think we need to get to the point as a community where we think the same way about public health. We know diseases are coming. We need to fund and prepare and be ready. And we're not. I think we're so reactionary when it comes to disease. And it's been a bipartisan problem. I mean, I think when it comes to cutting funds, right, it's certainly, more on the side of the Republicans, but even Democrats, I think, have not been as proactive as they should be in thinking about the ways disease can ravage our communities.
Because we've had professionals on the show before, and they're saying, hopefully this is the last pandemic that we see in a while, but there are other possibilities out there. The threat is always out there. It's about how we are preparing for it and our response to it as well.
Yeah. And I think that's a cultural political change for the country. Do we see public health as just this kind of extra thing that is fat on the bones that we can cut when times get a little rough, or do we see it as a centrally essential function of government, much like we protect military funding, because we know that kind of national defense is so essential?
It's been it's such a crazy time in our country over the past 10 months. But I think the good thing that comes out of this is it does start to open up our thoughts and our minds and our process to some of the things that are going on globally. Other parts of the country or the world have been experiencing this prior to just COVID-19. So hopefully this continues the conversation and education as well, which is so important. So Mark Navin with us, he's the professor of chair of philosophy at Oakland University. Hey, Professor, can you tell us again, I know the event tonight is free, but people need to pre-register. How can they do that?
So that's a great question. I just sent to your producer, Lawrence, the URL on Eventbrite that they can register for the event to spend time with Dr. Bagdasarian from Michigan Department of Health and Human Services, Dr. Faust from Oakland County Health Department, Dr. Gilpin from Beaumont Health to talk about, and Reverend McDonald from Prospect Missionary Baptist Church Pontiac to talk about vaccine for COVID in our communities and moving forward. But there is a URL to register, and I don't have an easy way to share it with you on live TV.
That's okay, though, just to let people to know as well, our Facebook partner, Oakland University today, but also I posted that information about the event tonight on my journalist page, so you don't have to be a friend of mine. I never understand why Facebook limits people to 5,000. It's just crazy. Like, you shouldn't have to. But you can find it on my journalist page as well. Really a fascinating conversation, and we appreciate you and all of the people over at Oakland University putting this together. But I am excited. You guys have a lot to cover in just an hour, though.
We're going to try and stay very disciplined and focused on people's questions about the vaccine and when they might get it and how it works and any concerns they might have. We want to make sure we address those in that time we've got. We have over 300 people registered, which is for us a pretty big Zoom event. So we're pretty excited about that.
Well, that's awesome. With that, anything quickly I didn't ask you that you want to add in before we let you go?
I mean, I'm just always happy to have the opportunity to say that the Pfizer and Moderna vaccines are safe, some of the safest vaccines we've ever seen, amazingly effective, and that people I know in Michigan are doing the best they can to get you access to that vaccine as soon as they can. So
I will say, I'm one of those people, like, I get woozy even taking my dog into the vet and seeing them put the needle in to pull the blood. So I'm not a needle person. I'm waiting for the Johnson & Johnson. It's a one needle vaccination, and hopefully that's going to be coming on the market soon.
very soon. Dr. Fauci said maybe in 2 weeks it'll just come to FDA. So we're crossing our fingers on that.
Fingers crossed. I'll take one needle poke versus two any day.
Fair enough. Thanks, Ronnie.